Hello, this is Siddharth Tambar from Chicago Arthritis and Regenerative Medicine. So I've been thinking about how to verbalize what I think is one of the critical challenges in regenerative medicine at this moment. The field has progressed so much in the last 10 years, but there are some aspects that could really kill off this field pretty fast if we don't correct. I've had difficulty in terms of figuring out exactly how to verbalize this, so I'm going to rely on someone who's much more profound than me. There is a very famous line by Ice Cube from the movie Boys in the Hood, where he says that either they don't know, don't show, or just don't care. This is I think this speaks to the problems we have in regenerative medicine. There's a large group who are involved in regenerative medicine who just don't know. I think in order to be an expert at regenerative medicine, a leader in regenerative medicine, you have to really understand the concepts of prolotherapy in terms of how to completely treat an area that is dysfunctional and painful. You need to understand orthobiologics. You need to understand when you use a high dose of platelets versus a lower dose of platelets, when you use platelet-poor plasma, when to use the different sort of products that are available. And then lastly, you need to be extremely precise with treatment, meaning you need to be an expert in interventional orthopedics. You need to know how to use X-ray and ultrasound guidance so precisely that you are down to a sub-millimeter when you're injecting. Those are required to be a leader. There are too many people involved in the field right now who are not fully experts in all three of those things. So somebody might have a really good understanding of prolotherapy concepts and even orthobiologics, but they don't have the image guidance skills. There may be others who are super really smart and understand the different types of orthobiologic treatments around, but they don't have the image guided skills to treat patients properly, and they don't understand the prolotherapy skills and concepts. Now, you could say that within a field, you're going to have people at different stages of growth and knowledge. The issue is that we have, let's be honest, we have leaders in the field who have knowledge gaps in those three things. That's an issue, right? Because we need leaders who really are experts in all aspects. Now, the good thing is that gap in education can be corrected. But let's call it out for what it is, that our leaders in this field should be experts in all three of those aspects. Number two, don't show. I'm guilty of this. We do have people that have a high level of competence, who understand what it takes to make this field work, who understand how to deliver high quality patient care, but they're not stepping up and doing what they need to do to lead. I'm guilty of this as well. I have certainly been through my professional career where I'm focused on what I need to do on that day with my patients to get things done. But we have to be honest that for those of us that really want to be in this long term and have the best interests of this field long term and how to do it correctly, we have to step up and show up. It's been said that in Canada, when the health regulator came out and decided to ban everything that had the word stem cells in regenerative medicine and possibly other point of care products as well, that part of the problem was that there were no significant practicing physicians that were in the regulator's ear. That's a problem. We certainly need to step up and we certainly need to show up. And what that means is we need to really call out what are best practices and what is not. It's uncomfortable as a physician to call out other physicians for not doing things as well as they could. But we should at least try to set the example and speak out more about what are best practices. I think regulators will respect that. But I really think that I see a lot of my colleagues complaining about regulatory overreach. And we have to realize that the regulators are not the enemy. We have issues within our own colleagues that can be corrected. And I think that's where we need to spend our time and then interact with regulators at the same time to show how we're leading. And lastly, and most problematic, I think, are the problems of those who just don't care, right? Don't know, don't show, just don't care. They may care about their patients, they may want the best for their patients, but do they have the best interest for this field long term? Let's be honest. If someone is using amniotic or umbilical cord fluid and calling it stem cells when there's no live stem cells, they don't have the best interest in this field long term. If someone is treating patients without image guidance and thus not delivering precise precision care, do they have the best interests for this field long term? I don't think so. If someone is treating patients without an understanding that regenerative medicine really counts on understanding prolotherapy concepts, they're not as high of a standard of care as they should be. That's a problem, right? If someone doesn't care to do this as well as they can be doing it, that's a real problem for our field. That's a lot. I appreciate your time. I think this field can move tremendously in the next 10 years. It's moved tremendously so far these last 10 years. But that next push really does require us to recognize where our problems are. And part of recognizing problems is being honest with ourselves. Being honest that the problems are not with external regulators. We can do a lot to help ourselves by correcting our own problems right now. And I think that's what's going to take us to the next level. Leave me your thoughts. Thank you very much, and live well.